Good afternoon. Good afternoon, and thank you everybody to tuning into this special Thursday press conference. We'll try to keep it shorter, but there's a few important things that I wanted to discuss with you. Next week, I'll be back at 1 o'clock on Wednesday. We'll get back into our Wednesday rhythm. Also tomorrow at 2:30, Dr. Alexander Scott will be joined by her colleague, Dr. Chan, doing a special Facebook Live event. So I would encourage you to tune into that. And then I'll be joined on my Facebook page by Dr. McDonald on Monday at 10 a.m. And I hope you'll tune into that. So as I said yesterday, we're in a tough spot right now. We're not where we would want to be. And we have to make some changes so that we have to course correct. You know, yesterday I talked a lot about Wisconsin as one example. If they had made some course corrections a few weeks ago, they wouldn't be opening a field hospital today. So that's what we're trying to do now, raise the alarm, get everybody focused a bit more so we can course correct. And to that end, I want COVID to be top of mind for everybody. I'm asking you to be a little more conscious, a little more aware. Tune in today, tune into the Facebook tomorrow, tune in on Monday. I want you to start asking yourself, what can I do? What can I do to get Rhode Island back on track? And part of that is staying informed. So if you have some time, I'd ask you to tune in to these extra pieces of coverage that we are having over the next few days. So we begin as we always do with the data. I'd ask you to please put the dashboard on the screen. Not a great day yesterday. We performed over 12,000 tests. That's good. And unfortunately, we had another 228 cases. So we continue our climb for a percent positive of 1.9%. And sadly, we saw yet another 2 deaths of Rhode Islanders due to COVID. As I said yesterday, so the good news is we're doing a lot of testing, a lot of contact tracing. Someone asked me, is this the spring? This is not the spring. We have a pretty sophisticated system set up, so we are better able to pinpoint where the problems are. And the overwhelming problem that we have now, the overwhelming pattern, is small gatherings of family and friends, informal, casual gatherings where we feel comfortable. We're with people we know. And so that feels safe, and we let our guard down. We get within 6 feet. We share food. We take our masks off. Not so much huge gatherings. So now cases are coming. We're seeing the cases coming from intimate indoor gatherings. You invite a few neighbors over to the house for dinner, which means there aren't as many levers that I can pull. You know, it's harder to regulate and enforce our way out of our problem now, because most of the problems we're seeing are happening in your home, in your backyard, in a break room. So I'm going to be counting on each and every Rhode Islander to just be more aware and try a little bit harder. Because the changes we have to make are in our personal lives, you know, in our homes, in our cars, in our backyards, in our neighbors' homes, in our neighborhood. And, you know, look, this is really hard. We've been at it a long time. By and large, everybody is following the rules. Everybody is trying. Everybody is sick of doing this. And I hear you. Having said that, we just have to try a little harder, get a little more focused, because we're in a bad spot right now. And we know if we make some adjustments, we'll get back on a better path. And unfortunately, we also know with certainty, if we don't make adjustments, things will get worse. And then I will have no choice, as is happening in other states, but to pull back on our economy, pull back on what we can do. By the way, I don't want to do that. And if we all come together again now, I don't think we'll have to do that. So today I'm going to outline some actions that we can all take to be part of the solution. But I really want you to ask yourself, Rhode Island's in a tough spot right now. What are you going to do to adjust your behavior at home, with your family, with your friends, in order to make progress and help us out of this incline in cases? And I'm going to give you a few suggestions. So let's start with holidays. Halloween's 2 weeks away. Yesterday, I asked you to cancel your Halloween parties. If you haven't had a chance to do that yet, now's a great time to do it. I want to talk especially to young kids, high schoolers, college kids, young adults. I know Halloween parties are fun. You look forward to them. You're young and healthy. You want to have a party. This year, no Halloween parties. It will make everything less safe for everyone. So trick-or-treating, we are going to allow. A couple of weeks ago, I said we'll have trick-or-treating. Yesterday, we were asked about it. We thought long and hard about it. And we're going to go ahead and allow the kids to trick-or-treat. Trick-or-treating gives young kids a sense of normalcy, an opportunity to be outside. It's a big deal. Having been a mom of little kids, trick-or-treating is a big, important part of their lives, and so we want there to be some trick-or-treating. But I want to say this, to those who are going trick-or-treating, you have to wear your mask, and not a costume mask, a face cloth covering, even when you're outside, while you're trick-or-treating, and please go in small groups. Go really with the people you live with, you know, your family, maybe the kids who you're close to at school, you know, people who you know, who you already spend a lot of time with, and it's a small group. Parents, I need a hand enforcing this. And I know that won't be easy because the kids like to go out in big groups and run all about, but please have them wear their masks, wash their hands, and go in small groups. I'm also asking that you do your trick-or-treating during the daylight. So maybe start a little bit earlier. We'd like trick-or-treating to start and end before it gets dark. As it gets darker, it's harder to control things and harder to stay safe. And frankly, kids, the longer they're out, the harder it is to follow the rules. So let's have fun, let's trick-or-treat, let's do it safely, but let's limit the amount of time that we do it for and try to get in the house before it gets dark out. But if you're a parent, I'd also ask you to consider alternatives to trick-or-treating. You know, maybe buy candy for a movie night, watch movies, maybe watch movies outside, arrange a Zoom where your kids can show off their candy to their friends. Any other creative, safe ways to celebrate Halloween where the kids can get dressed up in their costumes, I would ask you to think about it. Back to the college kids and high school kids and really anyone else. Please don't have a Halloween party. Yesterday, it was said to me, someone said, "Hey, Governor, I'm not canceling my party." So let me just say this to everyone. I'm asking you, please, to forego Halloween parties for 1 year in order to save lives. If you do have your party, you will be part of an increase of cases that is going to lead to more hospitalizations and more deaths. If you have 25 people over, you might not get sick, but others at your party might. They may be young and healthy, they may be asymptomatic, but they may go to work the next day or ride the bus the next day, and then get somebody else sick. And before you know it, our hospitals will be overflowing. I'll be shutting down businesses. Our unemployment rate will go back up. People won't be able to go out for dinner again. So I'm just asking you to do the right thing, not be selfish, and know that in doing the right thing, you'll be saving lives and jobs and businesses in Rhode Island. Having said that, if you insist on having a party, and if your party is greater than 15 people, then we will shut you down. Because the rules, and these are not new rules, I'd like to take this opportunity to remind everybody of the existing rules, regulations in Rhode Island as it relates to COVID. Social gatherings of more than 15 people are not allowed. And if you do have a party, you can be fined $500 per person at your party, and individuals at your party can be fined. So, and the state police is tripling its enforcement presence around Halloween. We're in contact with mayors and local police. They're also going to be increasing their presence for enforcement around Halloween. And our DVR inspectors are going to be out in full force at bars and in restaurants. So I'll end where I began, which is asking you not to have a party. Because if you do, you're going to be facing a very steep fine, not to mention the fact that you'll be endangering the lives of Rhode Islanders and your loved ones and other people's loved ones. Parents, I need a hand from you to crack down on high school Halloween parties. So if your child was planning to invite a lot of friends over for Halloween, or you know your kids were going to go to a Halloween party, please help us out and don't let that happen. This isn't forever. This is for now, because we're in a bad spot and we have to bend the curve again. Next year there'll be Halloween parties. There'll be plenty of ways to celebrate, but I'm asking everyone to just pull together to do the right thing. And just try a little harder. By the way, I know you're all trying, everybody's already trying. Rhode Island's doing a great job. Our lives have been totally disrupted, and this is a tough ask for me to ask of you. But particularly as it relates to our young people, we are seeing cases skyrocket among young people, 19 to 24. So give us a hand if you can, please, to keep a lid on these parties. I know people are also starting to plan for Thanksgiving, so today I'm asking you to keep it local this year for Thanksgiving, and consider not traveling. In my family, as I said yesterday, we always go to Michigan to visit my husband's family. We look forward to it, but this year we're not going to go. Next week, I'm going to have a lot more detail around Thanksgiving, official rules, how we envision a safe Thanksgiving. But I know a lot of people are making plans now. There's no official prohibition, but I'm just asking you, please, to keep it local. We're in a precarious moment right now with our cases, and it would be great if you stayed local. We've talked all along about how our actions impact case numbers. What we do today will impact our case numbers in 2, 3, 4 weeks from now. So we're entering a tough few months right now, because 3 weeks after Halloween is Thanksgiving. A month after Thanksgiving is Christmas. And if we don't really start planning now for how we're going to have safe, small, local gatherings, then I worry that we're going to have bigger gatherings. And as a result, we may have to think about shutting down more globally in our economy, which is what I don't want to do. We had a stay-at-home order for Easter. We had a stay-at-home order for Mother's Day. We had a stay-at-home order for Ramadan and Passover and Father's Day. We don't want any more stay-at-home orders. We definitely don't want stay-at-home orders for Christmas and Hanukkah and New Year's. So let's pull together right now, stay local, stay small, keep our masks on so we can get to a better place. Okay, second thing I want to talk about, I'll be very brief because I know the doctor's going to talk about it, is mask wearing. I want to begin by saying you're doing a great job with mask wearing, particularly in retail shops, businesses, and restaurants. So I want to be clear, you know, and restaurants in particular, You've done an amazing job, so thank you. Unfortunately, we have to do a better job of mask wearing in our small, casual, social settings. Going over to our friend's house, letting your kids go over to their friend's house. It's in these comfortable settings that we let our guard down. And we can't do that anymore. By the way, I'm talking to myself and my family too. We're all guilty of it. We've been at it for 7 months. This is a hard thing to do. And still, we have to do a little better. So I'm asking you to just have a renewed vigilance around your mask wearing. Just ask yourself, is there any reason why I wouldn't have my mask on right now? And the answer is probably no, in which case you should go ahead and put it on. You're at your friend's house for dinner, sit more than 6 feet apart. Sit outside. Wear your mask when you're not eating. If you're at a restaurant, put your mask on before your food comes. Keep your mask on while you're placing your order with your server. Later today, the Department of Health is going to be putting out new guidance around mask wearing, and Dr. Alexander Scott is going to talk about it in a minute. But suffice it to say, just a wake-up call for all of us, even when we're in casual settings with people we know and trust and love, be more vigilant about mask wearing. The virus doesn't discriminate, unfortunately. So there are people you know and trust and love, and they feel safe to you, but the virus doesn't discriminate, and they could be carriers. You could be a carrier and asymptomatic. So we really just need to be more careful everywhere wearing our masks. Another area where we've seen people get too comfortable is in break rooms and common areas in offices. It's the same pattern we see everywhere else. If people are in a structured environment, on a bus, at a school, on a manufacturing line, things are going pretty fine. It's when you're in a casual atmosphere like a break room that we all get a little bit relaxed and we're seeing a rise in spread in cases. And that's in an unstructured break room. People are chatting, they take their masks off, they're with their coworkers, so they assume it's safe. They get too close, too cozy, too relaxed, no mask wearing, and we're seeing problems. The other problem is in most places of work, break rooms are small, indoors, pretty confined, and have no windows. In a small break room, just a few people in there without a mask, there's a lot of spreading. So, and it's preventable. So effective today, we'll be announcing new regulations requiring the closure of break rooms for the next 90 days. We're also leading by example. I've asked Director Smiley to join us today. He's been working hard to close break rooms in state buildings and offices, but also ensuring employees have the time and opportunity that they need to take a break. By the way, that's important. I'm not saying don't take a break. I'm not saying don't have a coffee break, don't have a time to relax, don't have lunch. Of course you need to take a rest, take a break, have lunch, rest your eyes, have a cup of coffee. But we have to, employers, I'm asking you to find alternative, safer ways than small break rooms in order for your employees to take a break and take a rest. Allow time for employees to do this, allow space for employees to do this, encourage employees to go outside, to take a walk outside, set a table up outside, set a tent up outside, get another room that is much, much bigger and you can keep the windows open. Require everyone to keep their mask on when they're in there. There are some employers I know that are governed by either contracts or federal regulations, and this may be difficult to comply. So in those instances, obviously we don't want you to break any of those rules. We have specific guidance available for you, and we want to help you. This is not meant to be punitive. We want to give you a hand in business so that you can close your existing break rooms, but also give your employees a safe place to take a break or have a meal. You can go to reopeningri.com, and that will have all the details and also some ideas. Some ideas, as I said, allowing folks to go outside, having a room with a refrigerator, letting people store the food in the refrigerator, but they can just go in with their mask on, get their lunch, eat it someplace else, having a sign-up system for a particular room. Just, we know we're seeing spread with 3, 4, 5, 6 people in a break room with no windows, no mask, so we have to stop that. And this regulation is in effect for the next 90 days. And again, all details later today will be at reopeningri.com. I do want to be clear, we're not talking about cafeterias. You know, many workplaces have a cafeteria or a big lunchroom. Obviously, schools have big cafeterias and lunchrooms. We're not seeing problems there. These tend to be big enough spaces, a little bit more structured, often have windows. People can sit a few feet apart, windows can be open. So we're not talking about cafeterias or large lunchrooms. We're talking about smaller break rooms where people congregate. All right, employers. Here's the good news. This is how you know Rhode Island's a special place. I've been getting asked a lot, and even in the last 24 hours by employers, hey, what can we do? By the way, they want to stay open. They know there's real consequences to going back up the curve. They can't afford to close their businesses. So they're asking, how can we help? So I want to thank you. Thank you, thank you, thank you. And by the way, remind you that by and large, businesses are doing a great job and we're not seeing huge spread. Except in manufacturers, we are seeing some issues and we're addressing that one-on-one with manufacturers. So I want to talk about 3 quick areas that business owners can lead. First, if your employees can do their jobs from home just as well as they can in the office, go ahead and let folks stay at home working from home. I realize that's not true for every job. And as I said, by and large, we're not seeing big problems in workplaces. Having said that, there are many jobs that you really can do them just as well from home. So continue, please, for now, to let people work from home. Second, please make it as easy as you can for employees not to carpool. I know that's hard. That's a hard one. I'll just say this. We're seeing spread from carpools. That, by the way, is contributing, I think, to some of our problems in manufacturing operations. So if you have to carpool, obviously you have to and you need to do it. Wear your mask, even if it's your best friends that you carpool with, and keep the windows down. Wash your hands. If there's ways that you can change, if you're an employer and you can change the schedule to help folks cut down on carpooling, I'd ask you to think about it. I also ask employers to talk to their employees about the dangers of carpooling irresponsibly and ask your employees to wear their mask and be careful and keep the windows down. And then third, I'd ask you please to encourage your employees to go ahead and get tested even if they're asymptomatic. And I'd ask you to put the slide up on the screen, please. The slide on the screen is a reminder of all the different groups that are the current areas of focus for our asymptomatic testing program. Anyone who falls into these categories that are before you, please go to portal.ri.gov and sign up for a test. The test is free. We're going to make it as quick, easy, and painless as possible for you. And it would be awesome if a lot of hairdressers, waiters, waitresses, barbers could get out in the next week and get tested, even if you feel great. We need to increase our testing of people without symptoms, but who are in these high contact businesses. So my ask, if you own a restaurant or manage a restaurant, if you own a salon or manage a salon, if you own a spa or manage a spa, a nail salon, etc., encourage your employees to go get tested. It's free. Give them the time in their schedule to go get tested, even if they feel great. We need to make a big push. We have a goal of running 4,000 tests next week on asymptomatic people. So if you're a service worker, any service worker, if you have a job, put you in contact with people, and I mean any, if you're a member of the clergy, work in a retail operation, please just go get tested. If you want to know, hey, Gov, how can we help? Go get tested. Next week, portal.ri.gov, we want to test 4,000 asymptomatic people so we have a feel for how prevalent the virus is throughout our community. Okay, a few other asks. Teachers and principals, talk to the kids about how they shouldn't have Halloween parties and why they shouldn't have Halloween parties, the importance of wearing their masks when they're out hanging out with their friends, and help come up with some creative alternatives to these holiday parties. College and university leaders, crack down on the Halloween parties on campus, please. If you have a Greek system, please consider stay-at-home orders. Off-campus dwelling, please, you know who you are. We've already had enough problems with higher ed, partying, off-campus. Halloween's coming up. We have time to prepare. I'm asking you for your cooperation. And by the way, let us help you in any way that you think we can help. Faith leaders, I would say first, you're doing a good job. You're doing better than good job. It's been great. I personally have been in a number of different places of worship over the summer. Great job. But we have to do a little better. It's not so much in the church. Again, in the church is structured. You've kept it short services. You keep the windows open. It's what happens after church. 3, 4, 5 people go to someone's house for a cup of coffee. Somebody goes out for breakfast. There's a coffee hour sponsored by the church. People you're comfortable with, you don't wear a mask, you get close together, you share food. Please, faith leaders, help us out over the next month. Ask your congregants to just cut that down, or if they have to be together, wear their masks. Bus drivers, please make sure everyone is wearing a mask when they get on the bus, when they're on the bus, when they get off the bus, and we're handing out masks to anyone on a bus who doesn't have one. Waiters and waitresses, go get tested, please. Wear your mask. By the way, all of you already are. Thank you. And stress the importance to your customers of wearing a mask. So I'm asking you today just to think about how you, all of you, in your personal and professional lives can make some changes, sometimes small, so that we can keep everybody safe. Finally, I was asked yesterday about my comments a week or two ago when I said I didn't imagine moving beyond phase 3 until there's a vaccine. And so I did want to clarify one thing, especially for our business community. While I can't imagine moving to a phase 4, which would be a wholesale reopening, including concerts and conventions and big gatherings, that doesn't mean all of our existing restrictions are going to remain in place as they are today for months. In fact, I really would like to begin to relax in certain ways. So for instance, a week or two ago, I said, we relaxed the table settings outdoors at restaurants. We said they could be closer together. We want to continue to do those things, a little bit larger weddings, a little bit more here, a little bit more there. Every dollar matters for businesses that are struggling, which is exactly why I'm asking you for your help right now. If we all recommit ourselves now to being as vigilant as we were a few months ago, then we will flatten the curve. Hospitalizations will go down, cases will go down, percent positive will go down, and we can get more people back to work. But unfortunately, if we don't, then we'll see the exponential rise, and that's just not a place we want to be. The reason I'm here today is because we have warning signs. We have great data, great testing, great contact tracing. We're seeing the flashing lights, the flashing yellow lights. So let's get on it. Let's change our behavior in every way that we can. I was asked yesterday, are we going to send the cops when mom is over? Of course we're not going to do that. We can't. I won't. And I have faith in you. I have faith and confidence in the people of Rhode Island. So as tired as we are, it's time to just buckle down a little bit especially at home, especially when we're relaxed. Keep it more local, cut down on your social interaction, wear your mask all the time, and I am totally confident that that'll get us to a better place. And then we can get on to the business of actually opening more businesses instead of throttling back, which would be a very bad place to get. So I'll turn it over to the doctor and then come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us on a Thursday this week. As the governor shared, we have 228 new cases to report. That's a reflection of needing to get everyone's attention. You see the flashing warning signs that the governor shared so that we can make a difference right now. Our currently hospitalized number is 129 compared to 131 yesterday. There are 12 people in the intensive care unit throughout the state and 5 people on a ventilator. These numbers are similar to what we shared yesterday. We sadly have 2 new COVID-19 associated fatalities to report. Both individuals were in their 90s. Our prayers are with the families of these 2 cherished Rhode Islanders. And it's an example of why we are back here today. We want to work with all of you to be able to preserve the lives of Rhode Islanders going forward. Hopefully you've identified the theme of our conversation today. As the governor has shared, we are getting much more serious when it comes to wearing masks. I see it as my responsibility as the physician to help you understand the science and the data that drives our push to you. We've said from the beginning that we're going to learn as we go, that things are going to evolve as we go through this pandemic. Prior to now, our messaging has been, and people have responded, to wearing masks out in public, keeping your environment structured, keeping your distance, make sure you're washing your hands. That has to continue. That is what has kept us in the place where we are now. As a region in the country, our numbers, and particularly our percent positivity, has been holding steady. And that's because people have done the work that we're talking about. Why we are here sounding the alarm is because we're seeing the warning signs. The numbers are creeping up. And so that means we have to do something more. We have to go beyond just wearing masks in public, in restaurants, in retail, while keeping those things open. The science and the data tells us that not only in public, but also when we're around friends, when we're around loved ones, when we're in a comfortable zone, in a personal space with people that we know and love, that is also the time to wear a mask. Just because they are individuals that you know, that look like they're fine, don't look like they're sick, you see them on a regular basis, they're always okay, COVID-19 can still spread. It is still spreading in those situations. Our data is showing us that again and again and again, whether in your home with extended family members, in the place of worship setting as a social gathering, in a bar where people are mingling as we're telling them not to do, or in a workplace setting in a break room when your guards are down. That's the message we want to get across to you. That's the thing we need you to do differently so that we can stop the trend of the numbers that every state, particularly in this region, is seeing. Let's make Rhode Island the state that leads the way in changing the trajectory that's happening. This is how we do it. We, each of us, work together to be more vigilant with wearing our masks in those comfort zones, in those most casual, in our more casual spaces, and when we are with people that we know, that we're frequent with, that we love. That's when we need to wear our mask. The simplest way to think about it is mask wearing should now be the default. It used to be maybe it could be the exception and you need to wear a mask. Now let's shift it and make it so that mask wearing is the rule and there are only very few exceptions. That one exception could be when you are with people that you live with from your own household, sharing a bathroom with, bedroom, that type of thing, that may be an exception. But if mom, grandmom, friend comes to visit in your home, wearing the mask is the default. That's the rule. And that's what we want everyone to take away from this. In the past, we said you should wear a mask. Now we're saying make wearing a mask your default, whether you're indoors or outdoors. We want you to always have your mask on and with you. If you're going for a walk with a friend, wear a mask. If you're in a backyard and there are people there that you don't live with, you need to wear a mask. If someone in your home, if someone comes to visit your home who doesn't live with you, or if you are in someone else's home, masks need to be worn. We're telling you the data shows us again and again, those are the scenarios where COVID-19 is spreading. It's happening here in Rhode Island, and it's happening throughout our region. We are now saying wear your mask, it's the rule, not the exception, whenever you're around other people who you do not live with, period. Wear your mask whenever you're around other people who you do not live with. We're updating our guidance online to reflect this change, and it's all part of how our understanding about this virus evolves. When we are out in public around other people we don't know, we're generally good at wearing a mask. What we're asking is for us as a state to now take it to the next step and get those masks on in these additional settings, the comfortable settings, the personal settings, the casual settings, because COVID is spreading there. We know it's hard, but we know we can do this with all of us focusing on it together. In addition to updating the mask wearing guidance we have online, we've also posted information online at reopeningri.com to reflect the governor's announcements on Halloween, on break rooms, and on workplaces. Each of those settings, in a holiday, whether you're traveling or for upcoming Halloween, in a break room setting, in any workplace or casual gathering setting, those are the scenarios where masks need to be worn. We've seen cases associated with break rooms in all types of scenarios, and the true reason is just that's the situation where people's guards are down. They're eating, they're talking, they're taking a break from the structured setting. It's informal, it's unstructured, it's more casual, and people's guards are coming down. And so we're here today to say exactly when you feel that moment that you're comfortable and it's safe and it's okay. If you're not with someone who you don't live with, you need to be wearing a mask because it isn't comfortable, it isn't safe from a COVID-19 spreading standpoint. That's the message we want you to be able to have. As the governor said, business managers should encourage employees to be more creative in how they can take the breaks that they need to take. Eat lunch or take breaks outdoors whenever possible. In addition, we're reminding people about the need to limit the number of people who are in common areas at one time. Both of those situations, you need to continue to wear your mask. We're also asking business managers to post signs in common areas reminding employees about the 3 W's. Wear your mask, wash your hands, watch your distance. Another key is not having in-person office celebrations. That's yet another example of when people's guards are down, when they're feeling more comfortable, and they forget to wear their mask. Any situation that you can think of, whether you're an employer or an employee, clergy, teacher, principal, healthcare worker. Think about all of those scenarios when people are in their comfort zone and their guards are down, and that's where we need to sound the alarm. Whether it's a public setting, outdoors, or indoors. And as the governor said, if you can work remotely and still get the work done that needs to, please do it. That helps keep people outside of certain crowded situations. And no matter what, folks need to be able to wear their masks. If you're in a position at your workplace to get other people working remotely, do what you can to help make that happen. Also to employers, the governor mentioned about carpooling. Think of creative ways. Maybe you can provide some support for your employees to be able to get to work safely. Those that have to ride together, wear your masks. Roll the window down, wear your masks. I want to finish with talking to our youth, our young adults who are out there. We are depending on you. This is the time where you have the opportunity as a young adult not to just disregard this message and say it doesn't apply to us. The youth, the young adults, 20s, 30s, 40s, the ones who feel fine, who have no symptoms, you are who we're talking to when we're saying, please heed this warning. Work with us. Help care for those who are more senior or those who have underlying illnesses by just wearing your masks. When you're with your friends hanging out, when you're in some form of small gathering, social event, when guards are down, wear your mask. Our young adult task force has come together to help come up with ways to do that. I want to put a call out to our youth. We believe in you, we're depending on you to be a part of this with us. We're letting everyone know what the science and the data is telling us. This is why we have to do something differently, and together we can make sure that we have a different outcome in Rhode Island. So I'll just repeat that I'll be doing a Facebook Live tomorrow with Dr. Philip Chan from the Rhode Island Department of Health, so that we can continue to discuss together what else we can and should be doing right now to prevent the spread of COVID-19. We can get through this together.
In regards to break room closures, you mentioned that there are some circumstances that won't necessarily be feasible. For example, firefighters. Can you go into what this won't cover?
Yeah. So there are some instances, for instance, companies that do a lot of contracting with the federal government, they have to comply with the federal government's regulations. Sometimes there are in-union contracts, certain provisions. So I'm not suggesting to companies that they break contracts or violate regulations. In those instances, you have to find another creative way. In those instances, we would ask you to go to reopeningri.com and look at ways you can adjust the break room without closing it. Maybe you can have a sign-up system so there's only one person in there at a time. Make certain that everybody who's in there has a mask on. Keep the windows open and have a sign-up system. Only allow folks to, keep their food in there. So anyway, we don't want anyone to break rules, break contracts, get into trouble with their customers if it's the federal government. If you can, close them. If you can't, get creative. Put a tent outside, put a picnic table outside. Encourage folks to go for a walk.
I'm sorry if I can follow up. In that instance, you mentioned allowing one person in, one only. Does that apply to all break rooms or just in those circumstances?
We want break rooms to be closed, but if you can't, for whatever reason, then keep them open, but make accommodations like only one person at a time, a sign up, make sure everyone's wearing a mask, open the windows if you can. Like some things we're doing, remove the tables and chairs. remove half of the tables and chairs. Like, the problem is when you have like 6 or 7 people in a small break room all at once hanging around with people you work with without your mask on, drinking coffee for half an hour. That's a problem. So we can't let that happen.
I think a lot of people are asking, what was it that took an additional 24 hours to roll this out? Was it the Monday holiday? Is this a lot of this key to what you were told by Dr. Deborah Birx last week?
Yes.
Why the delay here?
Yeah. A few things. You want to get it right. I'm asking people to do things that are disruptive, so you want to make sure that it's warranted. We wanted to go through the data one more time. I'm trying to get to a place where we do targeted interventions. I don't want to go to the close the whole economy, close all retail, stay-at-home order. So we're really trying to sift through it to say, okay, break rooms are the problem, focus on the break rooms. So we just, we wanted to take our time to get it right. The Dr. Birx visit was really eye-opening, I can say, for both of us. We had the benefit to sit with her, and she took us through state after state after state in their experience. And so, we listened.
That was her message, right?
That was her message. She came here to see our universities, but I think she really came here to tell us, guys, I see warning signs in this data that I've seen in other states. So heed the message and make some changes.
On Halloween, the big thing you said was try to go out during the daylight. Most kids, my own included, want to wait till it's dark out.
I know.
You said that it's harder to control, but if you're going out in a small group, like just you and your parents and maybe a friend or two, why shouldn't they be able to go out at night? You said harder to control.
Yeah. So it's harder to get people, I know from experience as a governor and a mother, it's harder to get people to follow rules over a longer period of time. So, if you start trick-or-treating at 5 and you're still trick-or-treating at 8, human nature is you're going to stop following the rules over time. It's harder for us actually to kind of be out and about and see what's going on. So what I would say to you is we are not going to be in the business of finding children for being out in their little costumes. But I'm asking you as a parent, try to encourage your kids that this is a different year and get them at home by dark.
Just to follow up, apart from the break room order, everything you're saying here today is asking. Do you feel like, I'm asking you to do this?
Regulations are new regulation. The Department of Health is putting out new regulations today. State Police is tripling its force over the Halloween weekend. DBR is going to start getting a lot more serious about imposing fines and the break room. Those are the kind of concrete changes in regulation and enforcement. Beyond that, you're right. And that's why I was saying in the beginning, I'm out of levers. The stuff that's happening that's getting us in trouble is happening in people's homes, cars, backyards, basketball courts, playgrounds. That's hard to regulate with enforcement. So yeah, you're right. I'm just asking people to do the right thing so we can save the lives of Rhode Islanders.
Governor, for what we know about the virus, could someone that has COVID, could they spread it by giving out candy?
I'm turning that over to you.
Or whatever treat they may give out?
It is why we have given specific recommendations in the guidance that we want people to go to for Halloween on reopeningri.com. If someone has COVID, puts their hand all over, candy, puts it in a bowl, mixes it up, and has a number of other people come within a few minutes, within the hour, to touch the candy, touch the bowl, touch other things, yes, COVID can spread. COVID does live on objects and can spread, particularly if people are not wearing masks. So the first key is making sure everyone has a mask on. It's not just the cover of the costume, but an actual mask to prevent spread. Making sure that we're doing it in the daylight so that by dark, the number of people who are still out there doing it has decreased. And those who are setting the candy out, keep their doors closed, place it on a tray or place it open, individually wrapped, so that someone can just pick it and go. In those situations, the risk of transmitting COVID is significantly decreased.
What about parents when they get home? Should they wipe off the candy or other treats that the children get?
They are certainly welcome to.
Should compromised people be even interacting on Halloween? I mean, is that even worth it at this point if someone is older and compromised?
It is not worth it. It is not. If someone's older or has underlying illnesses, going to parties, engaging in Halloween, doing other things that place you at risk, this is not the time to do it. It's also why it's so critical that everyone wears a mask, because if you feel fine and you're healthy, but you are exposed to someone who just has to be out there or has to come to your house, you wearing a mask can help protect that individual. That's why this message is about looking at your interactions differently in your own home. When someone comes to visit who's an older age or has some underlying illness, place a mask on while you're in the house together. Open the windows. Make sure that there's a distance in place. These are steps we can take to save lives.
Doctor, thinking back to the spring, one of the big issues was the availability of PPE, and specifically with respect to N95 and high-grade masks. What is the status quo in terms of both the retail sector and the state's supply of N95 or higher grade masks that can be distributed to folks who are frontline workers, or particularly those people who are most vulnerable, whether they're in congregate care settings? In other words, do we have the sufficient PPE for the general public now, and is that one of the major differences between now and the spring?
So with a huge credit to our PPE team that has been working through this entire time, the medical grade PPE, masks, and otherwise for our frontline healthcare workers is in an adequate supply. There's always more that can be obtained, but we don't have scenarios where people have run out right now. I would not say that regular members of the public should go and get the medical grade supply, because particularly with numbers increasing, we need to make sure that the medical grade supply of personal protective equipment continues to be available for our frontline healthcare workers. I do want to make sure that everyone has access to any kind of cloth face covering, and that everyone understands how critical wearing a mask is outdoors, indoors, in the public, in our personal settings. You do not need a medical grade version to do that. We do have enough for our healthcare workers, but we have to keep it that way. And the more we can keep people out of the hospitals because they're wearing their masks now, the better off we can be altogether.
But is it fair to say for an immune compromised person that if they can get their hands on an N95 mask, I remember back in the spring, this conversation was, maybe that's not a responsible thing to do, that equipment should be given to, I remember dentists giving away their personal protective equipment to frontline healthcare workers. Where are we at now just in terms of inventory? So if you're immune compromised and you have to wear a mask, can you morally acquire an N95 mask?
Our preference is to still make sure that the healthcare workers have the N95 masks, knowing that if everyone wears masks in the normal setting, whether you are immune compromised or not, you can be protected.
Doctor, on the topic of holidays, families are going to gather for Thanksgiving dinner, Christmas dinner. Aside from mask wearing, can you share just some general tips? Should families be temp checking at the table, getting tested before going to a relative's house? Can you just share some general practices?
Yes, so for holidays, any kind of gatherings, the number one message that overrides any step you take is to wear a mask. Number one message in those gatherings with family members, loved ones. Additional steps, because we appreciate having layers, are definitely keeping your distance, definitely washing your hands regularly. And if you do go to an event where family has come together and people have done those things, but you're still concerned, going to get tested is something that we have in place. We're building capacity to do so that people are able to keep track and increase the number of folks without symptoms who get tested. The number one focus, though, is making sure that you're wearing a mask in those settings, particularly through the holidays. We want people to be able to enjoy each other. This is the way to do that safely.
Governor, I have two questions. You talk about testing. Who's paying for the testing? What kind of tests? Are you hoping that the federal government helps out? Where do you, like, are you going to do PCR? Going to do spit tests? What kind of tests?
Yeah, okay. So right now we're paying for the testing using our COVID stimulus money. We have allocated more than $100 million for testing. We are employing some PCR test, some rapid test. We just started receiving for free from the federal government the Binax Now tests. So we are probably going to be using those more on colleges and universities, K through 12. So right now we have it divided into, there's our K through 12 system. So if you get sick or you feel sick in school, you'd go to the K through 12 system. They're using an antigen test and also a PCR as a backup. So that's K through 12. We have the portal that I'm really pushing today. That's for asymptomatic, that's for people who feel fine. The waiter, the waitress, the hairdresser feels great. I'd like you to go get a test. We're doing that mostly at the convention center, mostly PCR tests. And this is all, insurance will not cover testing for asymptomatics. So we are using our COVID money to pay for that. Most insurance will cover a test if you're sick. So if your insurance does cover it, then we'll charge insurance. But the bottom line is no one should worry about paying for it. We're going to spend well over $100 million of our COVID money to have testing everywhere. We haven't yet, we're not yet, these are all nasal swabs. The good news is if you were tested months ago, it was a pretty invasive swab. We've gotten away from that and it's a gentler nasal swab. We haven't yet started using saliva, but we're working on it. We're working on it and we hope to get one approved that we can use.
And then on the second question, I have a follow-up question. Yesterday you talked about Governor Whitmer and sort of the plot to kidnap her. Have you talked to her? And more importantly, have you gotten any threats from the FBI that you've been briefed on from the state police about trying to kidnap you or kill you based on your COVID restrictions?
So I'm not going to talk about my own personal security, except to say that I have a detail, top notch. I feel very secure and I feel very safe in the hands of the Rhode Island State Police. I did call Governor Whitmer. She's a friend. I think she's a terrific governor. I talked to her a couple times. You know, she's a strong woman and she has good security, but I think she feels as I do that there's no place for violence. There's no place for threats. You can disagree with her. People here have questioned my authority to use our stay-at-home order. It's fine to disagree. It is not okay. By the way, that's for everybody. You know, you're seeing an increase in violence across the country. Not okay. And so she's fine. She's holding firm, and she's doing just fine.
Are you worried about that coming up to the election in Rhode Island, the increase in violence?
Yes, I am. We're preparing for it. We are preparing for it. I hope it doesn't happen. I hope there's a smooth election. Everybody should vote. But we are putting security contingency plans in place because I think it's a possibility.
Thank you. Governor, two brief questions. Do you think this is the start of a second wave?
I'll answer it and I'll let the doctor answer it. I hope not. It's in our control, Anita. That's the bottom line. Like, I would say this could easily become that. So if we don't adjust our behavior, if we say, oh, the rules don't apply to me and my family, then yeah, it'll be the start of a second wave. No doubt about it. But we're ahead of it now. We're ahead of it now. We're not there yet. We have a test positive of 1.9. So if everybody does what we're asking them to do, then no, I don't think so. I think a month from now we'll be coming back down the curve. She agrees.
Switching gears a little bit to your comments you said yesterday regarding Pawtucket. The Pawtucket Teachers Alliance is calling your comments yesterday a reprehensible mischaracterization of the school department. They're asking for an apology. What's your response?
I don't agree with that. So what I said was that they are shortchanging the kids by not being in school. That's a fact. I'll just tell you the facts, Anita, and people can make their own decisions. The only kids in Pawtucket who are in school are pre-K and K, not first grade. That comment you read, they said that the littlest learners are in school. Last time I checked, a first grader was a little learner. They're not in school. First grade not in school, second grade not in school, third grade not in school, fourth grade not in school. Those are all little learners at home struggling because the adults aren't working hard enough, being creative enough to give those kids a chance. So I stand by my comments. Secondly, they pointed out that Pawtucket has more than 100 cases per 100,000. I accept that. So do hybrid. Do what Providence is doing. In Providence, which is also above the threshold, all pre-K through 5 kids are in school, but middle school and high school are hybrid. So do that. In fact, that's exactly what I said yesterday. Central Falls, Providence, do a hybrid for older kids. But to simply say, we can't do it, I don't think it's right. I don't think it's fact-based, science-based, and I think it's hurting the kids. So I will stand by my comments and ask them to give us a call and let them help them get these kids back in school.
Governor Raimondo, you and I spoke yesterday about purgatory, this sort of miasma that Rhode Island businesses, really businesses around the nation, find themselves in with this steady drumbeat of bad news and financial pressure. And let's be honest, we also live in a society where most pandemics are cured in under an hour and a half on TV and in the movies. We know that not to be true now. But at the same time, if I can unearth another 1970s era model, was managing by objective. We all remember that freshman year of college. At this point in time, given this,
college in the 70s, but I'll go with this.
okay. So, but given again this steady, realistic yet drumbeat of bad news, is there an opportunity at this point in time to put up some bogeys, as we used to say, some objectives, where if we meet this, then if X happens, then Y restriction is lifted or modified? If their businesses are looking for a silver lining.
Yeah, I think that is an excellent point. And the answer is yes. And once I get through this week and this messaging, I'm going to start to get to the business of doing that. So look, this is really hard and people are fatigued and businesses are barely getting by and people are wondering, when is this going to end? But here's the good news. It isn't forever. It's not. Even before we have a vaccine, I think we can start releasing restrictions and there will be a vaccine in a matter of months, not years. And then we can go back to a sense of normalcy. So I can tell you there's light at the end of the tunnel. But already we're also thinking of ways that we can help businesses regain business next year. For example, I think that mayors and we, the state, should, we've relaxed a lot of regulations, allowing dining outside, allowing dining on sidewalks. I think we need to take a hard look at all those regulations and allow them to continue to be relaxed so that when they can reopen, they can make up for some of the lost business this year. So I don't have any specific announcements right now, except to say that I like that way of thinking and we are going to start moving in that direction.
On Thanksgiving, you said stay local. How local are we talking? Should you go to Massachusetts? If you live in Providence, should you go all the way down to Westerly to see your cousins? And also, if you're supposed to wear a mask at Thanksgiving, how is that going to be practical when a typical Thanksgiving dinner, 10 to 12 people around a table eating? What's that going to look like? Are you worried about that?
So at some point, we all have to use our judgment. So I'd like you to stay off a plane. I'd like you to stay off a train. I'd like you to stay as local as possible. I'd like you to keep your family or friend gathering, however you celebrate, as small as possible. It's not the year to have all your aunts and uncles over and have 25 people. Maybe it's a different tradition, just your family or just your family and a couple close relatives. Keep the windows open. Maybe if grandma is older, maybe grandma has to stay in another room. Obviously, you have to take your mask off to eat and drink, but think about not sharing utensils, not sharing a big family style bowl. So look, we have to live and we have to have Thanksgiving and we have to be with family and we have to eat. But I would just say, we know what works. Keeping the windows open works, wearing your mask as much as possible works, paying extra careful to the compromised and the sick works, and limit the length of your gathering and limit the size of your gathering.
Governor, has there been an example in the entire crisis here of a private homeowner who has been fined by whether it's the COVID task force or anyone else, not a business, but a single homeowner for a violation of 15 or more, any of the other?
I don't know. We don't know, but I will get back to you.
Governor,
But I'll tell you this, and a special note to parents, parents of teenagers, parents of young adults or whatever. If you allow your kids to have a party, and the party's more than 15, and we find out about it, we're going to fine you. And how much you're fined will be, like all things, at the discretion of the officer there. But you could be fined $500 for every kid in your house above the 15. So it's pretty expensive. And because of where we are right now, we're going to start cracking down.
Asymptomatic testing, we're still hearing from some people, 18 to 39-year-olds who say it's still not as easy as just going to sign up. It may kick back that you need to pay and it's not free. Is it as easy as you make it sound to go get a test? And then,
it is, but we'll keep looking into it. So what we are doing, I'm asking Rhode Island to do a lot. What we are doing right now, today, tomorrow, next week, is making it easier to get a test. Next week, I'll have more details, bringing more testing sites online, just making it easier and free so everyone can go in and out. We might start doing maybe possibly more like stop and shop locations, more in the community. So it's pretty easy now. Give me a few more days and we're going to make it even easier.
just some people have suggested, because you're testing so many more asymptomatic people, college kids, a lot more mass testing, that you should separate the statistics for asymptomatic versus symptomatic people. What do you think about that, to give people a better idea of, is it just sick people who are testing positive or a lot of asymptomatic people?
It's both. We look at the data both ways. Because we're doing so much testing on college campuses, literally thousands of young people, all of URI, all of PC, all of Johnson & Wales, that's true, right? That is definitely true. It's mixed in the data and it skews the data. We look at it, we slice it and dice it every which way. We'd be happy to get it to you in a disaggregated fashion, but the bottom line is it doesn't change. Like, no matter how you slice it, test positive is going up, it's too high, cases too high, and hospitalizations. That's the thing, that's the lagging indicator. Hospitalizations have doubled in a few weeks. That's a problem.
I have family members who work in schools and they said that some teachers were denying tests because they weren't showing any symptoms. Will this testing include those teachers? Okay.
Yes, that shouldn't happen. I'm sorry, and try again, and it won't happen.
Any outbreaks at Twin River? We hear from a lot of the workers at Twin River.
Can I get back to you for sure
Yes.
on that? I think no, but let me be certain and get back to you. We'll do it today. I'm sorry. Go ahead.
Governor, you keep comparing our situation in Rhode Island to that of Wisconsin, but Wisconsin also has a unique problem that the governor of Wisconsin has been in a continual tug of war with the state Supreme Court, which keeps invalidating the governor's emergency orders. Back in May, the Supreme Court of Wisconsin said that the governor's stay-at-home order was not valid. And I think as of a couple of weeks ago, the state Supreme Court of Wisconsin invalidated another series of orders from the governor, including, I believe, mask wearing. And so that's admittedly a unique case, and the numbers from Wisconsin are scary. Do you feel that there's any kind of pushback in Rhode Island comparable to that? Obviously not from the state Supreme Court, but it was pointed out to me yesterday that, say, the Facebook Live comments from the public during these conferences, which I don't see because I'm paying attention to you, are
indicating a great deal of public dissatisfaction and frustration. And obviously, there's no probability of the Rhode Island Supreme Court doing what the Wisconsin Supreme Court did. But what are your concerns over the short term, next few weeks, and the longer term, next few months, and maybe even into next year, about how to maintain not only public compliance with these restrictions like mask wearing, like physical distancing, like hand washing, but more importantly, to maintain public support for those public health measures?
It's an excellent question. By the way, no analogy is perfect. We're not Wisconsin. In some ways, they're better off. In some ways, it's harder here because we are a much more densely populated state. You know, we tend to forget that. Rhode Island's one of the most densely populated states in America. I think we're number 2 behind New Jersey. That makes it tough to control this. Plus, we're connected, which is a beautiful thing normally about Rhode Island. We all know each other. It makes it really hard in this instance. Look, I worry about it. Just yesterday, I was in the conference and a sitting member of the state legislature said to me they refuse to follow the law. That's a problem. And there's fatigue. There's no doubt about it. There's fatigue. We have been grinding this out for 7 months. The problem is it's a brutal reality. And if you don't follow the rules, bad things happen. More people go to the hospital, more people die, more people lose their jobs. So if I could figure out a way to keep everybody safe and out of the hospital and employed without requiring mask wearing, we would do it. But, you know, like the doctor said, the science is pretty clear. We know mask wearing works. We know social distancing works. We know outdoors and air circulation and open windows really work. So I do worry. People are frustrated, by the way. I am too. You know, my kids are bummed. They can't go to parties. We can't go see their grandma and grandpa in Michigan. Can't see my family as much as we'd like. But we just have to hang in there. We just have to hang in there a little bit longer because we have the antidote and it's within our power whether we turn the corner or not.
What do you think are the public consequences then when, say, President Trump is infected with COVID and then tweets out, well, don't be afraid of it?
Yeah, I think that's terrible. I think there were real consequences to that. He also said, I almost died. So, you know, listen to whichever part of what he says that you like, but I mean, leaders have to lead. By the way, it's not easy. I understand people are unhappy, but if we keep them safe and we keep them employed and we keep their kids in school, then I think that's the best we can do.
Amanda, last question.
Governor, you say we can't control small social gatherings, but you could bring down the gathering limit. Are you thinking of doing that to below 15?
So we thought about that, but no, because many of the events where we're seeing spread are already below 15. You know, many of these events are, you have your girlfriends over for book club at 7 people, everybody sits close, they share coffee cake and no one wears a mask. So it's, yeah, I don't think that's it. So we're gonna work on enforcement of the big events. That's what we're gonna do. Events that are greater than 15 that we find out about, we're gonna enforce the rules. Below 15, it's what Brian said yesterday. You know, you have mom over in the living room. We don't wanna walk into your living room and disrupt that, won't do that. So I'm asking Rhode Island to do the right thing. Bye guys, thank you.